Good afternoon. My name is Greg Lakin, plastic surgeon at the South Florida Center for Cosmetic Surgery, and I wanted to welcome you to our talk tonight on the women's intimate wellness, which is another way of saying vaginal rejuvenation. It's a hot topic now in plastic surgery and in cosmetics. It's probably one of the top 20 procedures that is now being done in plastic surgery. It's become a very socially acceptable topic to talk about, and so it's exciting to be on the forefront of this new technology. Tonight we're going to be talking about the FemTouch, which is a new laser that treats dryness, itching, painful sex, mild stress, urinary incontinence, and vaginal laxity. There's other aspects of vaginal rejuvenation, such as surgical labiaplasty and other surgeries, but tonight we're going to focus more on the FemTouch. So the FemTouch is a new FDA-approved, safe treatment for those symptoms that I just mentioned: painful sex, mild stress, urinary incontinence, laxity, dryness, and itching. It is FDA-approved, it's safe, it's painless, it only takes 2 or 3 minutes to do, and you only need 2 or 3 treatments to have a complete effect. We recommend annual treatments after that as well. I've traveled the country and I've studied all the different types of laser treatments out there for vaginal rejuvenation, and the FemTouch is the best one that I've seen. I'm not a paid key opinion leader, although I have spoken with them around the country about all the different types of lasers, so I have nothing to disclose, but I just firmly believe in this type of treatment. The female anatomy of the vagina is a tubular structure. It's approximately 8 centimeters long. It stretches to twice its length during sex or childbirth, and it's surrounded by a mucosal epithelium, and that produces the mucus. Estrogen is a hormone which helps produce the mucus, and then it's noticed that after menopause, women take estrogen replacements to maintain the premenopausal state of their vagina. There are some women that cannot take estrogen, and there are changes that occur after menopause in the vagina, where dryness and itching start to occur. Painful sex can result from that. There are other symptoms that some women have after childbirth, such as stress, urinary incontinence, and laxity as well. And these symptoms can occur after giving birth to children or after menopause. So the epithelium, actually, there's been some scientific studies looking at the epithelium without and with estrogen, and it totally changes. The epithelium, or the surface lining of the vagina, is very thin when there's no estrogen, but when there is estrogen, the epithelium is much thicker and it produces more mucus. So it's a great, so it's very noticeable with the estrogen and without it. And these symptoms that I talked to you about, the vulvovaginal atrophy, the stress incontinence, and the vaginal laxity, everything can be addressed with vaginal rejuvenation. And FemTouch is a great modality, a new technology that can be used to treat this. So when did the FemTouch come about? Approximately 2 years ago. Everything has become FDA approved for vaginal rejuvenation treatments with lasers pretty recently, in like the past 2 years. So the FemTouch is FDA approved. It's a CO2 laser, meaning that there's other types of lasers out there, erbium, there's radio frequency types of lasers. This particular type of laser is a CO2. It's based on the original platform by Luminous, which is the company that produces it, that produced the facial resurfacing lasers called Fraxel, which is the Fraxel technology. And that resurfaces the face. It makes it smoother and tighter also. And similarly, somebody came up with the idea to treat the vaginal atrophy with the CO2 laser. And so vaginal rejuvenation was born. It requires only 2 to 3 minutes of treatment. It's required 3 treatments approximately 1 month apart, and then annual maintenance. The machine starts by being inserted the full 8 centimeters up to the cervix, and then it spins 360 degrees, and it's pulled back 1 centimeter at a time until approximately the 8 centimeters have been addressed circumferentially. If you have urinary incontinence, mild urinary incontinence, this can improve it by approximately 50%. And I do additional treatments to treat the external surface of the area of the vagina as well, if that's something of interest. This is painless, and there's really no downtime. You can go back to work immediately. We do ask that you refrain from any sex for 2 days after this procedure. Afterwards, after the first treatment, you would begin to notice some changes. It improves after the second treatment, and then after the third treatment, everything is life-changing. I've heard countless testimonies from various patients, and they've written me thank you letters, and I've gotten videos from telling me how much they've felt that this has improved their quality of life and their sex life as well. Who is not a candidate for this? Anybody that has any unexplained bleeding vaginally, if somebody has history of genital cancer, or if there's any uterine prolapse, and if there's any active cancer or any active genital herpes also. It's good to have a pap smear within 1 year saying that you have a normal pap smear. So why FemTouch versus the other competitor lasers? I think that this is because the machine is built with some of the best technology. It has a very strong power, so it can hit accurately very deep and affect change quickly without lingering and affecting more tissue than what you need. It's like the Rolls-Royce of the lasers that are out there for this procedure. There's other types of lasers out there that may use radiofrequency ablation that take 30-40 minutes to do, and so that can get a little uncomfortable after a while, and there are other side effects such as heat by other competitors. But with this type of laser, the FemTouch, there's no pain, there's no bleeding afterwards, and it's a very easy recovery. There's one patient who I vividly remember treating. She had a history of breast cancer and was not able to take estrogen replacement. So without the hormone therapy, she felt much more atrophy in her vagina, and she was very dry. She actually was not able to have sex for 7 years, and her husband ended up divorcing her. It was a really sad story. She came to me, and after the first treatment, it kind of dilated her. She had a little pelvic discomfort and mild bleeding. This is not normal. Most people do not have this sort of atrophy. She was an extreme case, and I mean, you could barely fit the device in her, and the device is not that large. But after the second treatment, she noticed that she was much more lax and already began to produce some mucus. And after the third treatment, she was almost totally normal. So now she's going off, and hopefully she's going to continue her life and have great new beginnings. I just had another patient come back to see me for a facelift, and she had been previously treated by me with the FemTouch, and she was raving about it. She told me how she and her husband didn't have a lot of sex leading up to that FemTouch treatment. And after the first treatment, it got better. After the second treatment, even better. And after the third treatment, she says that her husband is the happiest guy alive right now. So this treatment has enormous potential for improving the quality of life of women. Surgery is another aspect of vaginal rejuvenation, which I can talk more about at another time. Or if you have any questions, I can discuss that as well. Surgical treatments for vaginal rejuvenation include a labiaplasty, which is removing some of the excess skin around the end of the vagina, a clitoral hood reduction procedure, which is removal of some of the excess skin over the clitoris or the top portion of the area of the vagina, and a vaginal plasty, which is excision of some of the excess vaginal wall if after childbirth there's too much laxity, more than what the laser can treat. In combination with the FemTouch, you have a complete comprehensive vaginal rejuvenation. So just in summary, the FemTouch for vaginal rejuvenation is an FDA-approved safe treatment to treat dryness, itching, painful sex, mild stress urinary incontinence, and laxity. It only takes 2 or 3 minutes. It requires 3 treatments separated by 1 month apart and annual maintenance, and it is life-changing. So I welcome you to the South Florida Center for Cosmetic Surgery. My name is Dr. Gregory Lakin, board-certified plastic surgeon. It was a pleasure talking with you tonight.